Okay, let's get started since we are under a little time pressure. Good morning. My name is Senft-Daniel. I'm from Knoxville, Tennessee. I'm your host today, and I would like to introduce you to our speaker. Today is Michael Okun. He likes to talk a little bit with us about the new book which came out and a lot of new exciting things. I think, Michael, you can introduce yourself. I guess a lot of people already know you.
Yeah, well, thank you for inviting me to speak with your group, and it's a pleasure and an honor to be here with PJ's Parkinson Support Group. And I'm talking to you this morning from the University of Florida. I'm in the Norman Fixell Studios at the University of Florida, the Fixell Institute for Neurological Diseases. And so it's great to be able to do this during the pandemic. And, you know, we ask everybody on the line here to go ahead and mute yourself. And the way you mute yourself on a Zoom meeting is in the lower left-hand corner. You take your little cursor and there's a little area that says mute on the lower left-hand corner. And if you go ahead and click that mute button, there'll be a line through your microphone, and that way we'll stay nice and quiet here throughout the lecture. And what I'm going to do for you this morning is I'm going to take you on a little bit of a journey through some of the things that we've learned while writing a book. And so recently, Ray Dorsey from the University of Rochester, and myself, and Bastian Bloem from Nijmegen in the Netherlands, and Todd Scherer, who is the CEO of the Michael J. Fox Foundation, together, the four of us wrote this book called Ending Parkinson's Disease. And one of my night jobs for many years since 2006 has been as the medical director for the Parkinson's Foundation. And so I've also been on quite a bit doing a lot of education on coronavirus and what to do and hospitalization and DBS. And we have a lot of blogs and we've got a lot of information that's out there. We've got a lot of recorded webinars on various things that are corona related. And so I just want to draw your attention to parkinson.org/coronavirus, all one word on coronavirus, parkinson.org/coronavirus as a really terrific place for you to get information. We also have recently added another page on just deep brain stimulation for the 1 in 5 or so of you that might have DBS devices. There's information about what to do with COVID during deep brain stimulation. And so this morning, I'd like to start and just read you a little bit, since we're in the middle of a pandemic. This is the book, Ending Parkinson's Disease. And so I'm going to read a little bit this morning from it and just give you a sense of pandemic. And the word pandemic as a word is derived from Greek, okay? And so it has Greek derivation used back in the mid-1800s. And the word pan means all, and demos means people. And so we're not trying to start a controversy by calling it a Parkinson pandemic. Obviously, that word has been hijacked by the World Health Organization and others to just refer to infectious diseases. But the word derivation itself just means all and all people. And when we think about a pandemic, we think about people across all continents. We think about a disease like Parkinson, and we think about the rapid growth we're going to talk about this morning. It sort of meets those criteria. So we don't want to necessarily weigh in and get into the discussion or the controversy about whether this is a Parkinson pandemic or not. But be that as it may, the derivation of the word all the way back to Greek would describe what we're experiencing with the growth. And so in the book on page 41, I'm just going to read a little bit for you this morning. This is talking about a new kind of pandemic. And it reads, epidemiology is the study of what comes upon groups of people, according to the late population health expert, Dr. Abel Omran. For most of human history, what has come upon people are famines and infectious diseases, and sometimes in the form of a pandemic. As opposed to epidemics, which are limited to a given community, pandemics cover large geographic areas. The Black Death killed up to 200 million people throughout Europe and Asia in the 14th century. The influenza pandemic of 1918 killed between 50 million and 100 million people worldwide and led to an unprecedented drop in global life expectancy. And you'll note that yesterday we saw the numbers in the United States rise to over 1 million affected Americans, and over 50,000 people have died. Thanks to public health advances, infectious diseases are no longer the leading source of death and disability. The new leader of the pack is chronic conditions. And in his landmark 1971 paper on population change, Umrang called our current era the age of degenerative and man-made diseases. And among these are cancer, diabetes, heart disease, and Parkinson's. The transition has led to some expand of the definition of pandemic to include diseases that are not infectious. The new carriers or vectors of these diseases are not bacteria or viruses, but urbanization, population aging, globalization, and widespread availability of unhealthy products. So Parkinson's disease satisfies many of the criteria of a pandemic. The disease is found everywhere in the world, in almost every region. The rate of Parkinson's is increasing. And in addition, as with infectious pandemics, Parkinson's disease appears to be spreading and growing as industrialization expands. And so I wanted to start, just with a little bit of a fun reading on the book. We'd love it if you can help us to spread the word. All the proceeds from the book go to charity. All of the authors we have all decided to send them to Parkinson's disease charities. So you'll be supporting a good cause. And more than that, we need people, especially since the book has been hidden a bit because of the COVID pandemic, to log on to Amazon.com where the book is out and give us a review. We'd love to hear what you have to say, but also we talk a lot about the Parkinson Pact, okay? Prevent, advocate, care, and treat. Prevent, advocate, care, and treat. So I'm going to flip here to share screen. I'm going to ask everybody, we have somebody who just joined who's not muted. Look at the mute on your lower left of your screen and just hit mute so we can keep everybody quiet here. We can have a little bit of a talk, and then we'll be able to take your questions through the chat here. So I'm going to share my screen here with you, and let's see if we can get this on. Okay. All right. Now you should see slide 1 covering the whole screen, and I'm just going to ask everybody, please go ahead and mute, all things. Isabel, do you want to mute everybody again and then unmute just me?
Yes, I did actually. Should we not?
Okay.
I guess they unmuted themselves.
Okay. Let's stay muted, everybody, so we can keep it nice and quiet here, because we're going to catch every bit of your dogs and babies and all the good stuff that's going on in your houses.
Maybe, let me say it in German. Andreas,
Ja.
Kannst du dich bitte muten? Wir hören dich, sonst das unterbricht das Dings. Kannst du dich muten? Oben in der rechten Corner. Yeah. Okay.
Okay. Now everybody should see slide 1 here, the full slide. Do you see that, Isabella, in your screen?
Mm-hmm. Yeah.
Okay. So I'm just gonna run through these things and talk about ending Parkinson's disease and emerging approaches and also therapies with the disease. So this is where I live. This is the Fixell Institute for Neurological Diseases at the University of Florida. It is a completely interdisciplinary, under one roof institute with rehabilitation, research, clinical care, research laboratories, everything under one roof, and all 10 different specialists you can see in one place. Also, in the last 2 years at the University of Florida, we opened a freestanding neuro hospital for neurology and neurosurgery. And so it's a cool place. If you're ever coming through Florida, stop by and give us a shout. We're going to talk about this prescription for action, and this is a nice cartoon that was drawn by one of Bastian Bloem's colleagues in the Netherlands, and we're all serious when we're holding these signs about what is the prescription for action, and we're talking about that a lot. And you'll see when we share social media posts now, we have hashtag ending PD, and we also have hashtag Parkinson Pact, hashtag Parkinson Pact. And we do that because we do need to get the word out if we're going to make a difference here.
We have done the impossible before. The suffering we experienced, it pushed us forward. It did not stop us. Stigma was there. Our brothers and sisters marched on the streets until it wasn't. challenge inspired us. Together, we rose to the occasion. We fought back. And we will do it again. We will end Parkinson's. Our fight begins now. We have done the impossible.
Okay, so how big is the problem? Okay. I think we need to get somebody muted here, Isabel.
Yeah, I try to.
Okay, so how big is the problem? And when we talk about how things are growing, Parkinson's disease is now the fastest growing neurological disorder. It's growing faster than Alzheimer's disease, which is really remarkable when we think about that. And why do we care? Well, we care for a lot of reasons, but 1 in 15 people in a lifetime is going to get Parkinson's disease. 1 in 15. That's remarkable. And if we look at the estimated projections, these have been done by Ray Dorsey and colleagues. From 1990, 2.6 million people. 2015, there'll be 6.3 million people. In 2040, there'll be 13 million people. And these are based on the world's most populous countries. If we also look at the lifespan here, if we look at life expectancy, as life expectancy goes up, we're also going to see a spike in Parkinson's disease. And the greatest advance over the last 100 years was doubling of the lifespan. So people live longer, and this drives Parkinson's. But this rapid increase, the rapid number of patients who are developing Parkinson's disease, this rapid increase isn't just driven by life expectancy. There must be other factors. So age is certainly a major factor, but not the only factor. Now, how many neurologists do we have to care for Parkinson's patients? Well, you're going to be pretty disappointed when I tell you that only about 40 neurologists or so are in a match in the United States per year to care for Parkinson's. And in the US, there aren't funds to cover the training of Parkinson's. So those are covered by individual organizations or university-based systems that will train these people. And so if we look at this, we need more neurologists. And neurologist care, we know, reduces morbidity, reduces mortality, and reduces nursing home placement. And this has been shown in Parkinson's. So we're not training enough Parkinson's specialists. And we recently reviewed this in a paper, and we realize now that the number of Parkinson's specialists trained in the US per year is 40. It's probably even less across the world because a lot of other regions don't have specific training for Parkinson's disease. And so the number of patients way outnumbers the number of specialists, which means we're going to have to do a better job of educating people in the care of Parkinson's disease patients. So what are the myths? And we talk about the myths in the book, the common myths about Parkinson's disease. It's all due to aging. False. It's not just due to aging. And in fact, the expansion of Parkinson's disease, this rapid expansion, when you factor in just aging, age is not the only factor. The other myth is that it's not treatable, okay? That's incorrect, okay? It is treatable, and we have developed multiple great treatments for the disease. Another myth is there's nothing to be done about Parkinson's risk, and that's also not true. We do have things now that we've discovered through research that we may be able to intervene on. And so when we talk about pandemics, okay, we talk about could Parkinson's disease and this controversy about whether it could be considered a pandemic, could it be considered one? And we don't, as I mentioned, want to wade too far into the controversy. It is non-infectious, at least as much as we know to date, but it does exhibit many of the common characteristics of Parkinson's. So pandemics extend over large geographical areas. Parkinson's disease extends over large geographical areas. They tend to migrate, and the burden appears to be shifting in response to changes in aging and in industrialization. And there is exponential growth, okay? There is exponential growth. So I'm going to pause here and just remind everybody, look in the lower left-hand corner of your screens. There's a little area called mute. And if you can mute, we're catching somebody's dishes and things in the background. It'll help us all to hear. And then finally, no one is immune to the condition, to the pandemic. So what's the next step for Parkinson's? Okay, Well, the next step is we need to have a pact, and we actually have a hashtag PACT. And so when you all are up on social media, we'd love it if you would use the hashtag PACT. We need to form a Parkinson pact. And when we were researching the book, we realized with HIV, with breast cancer, with polio, the key to getting ahead of a disease is prevention. That's the P in the pact. Advocating, that's the A in the pact. Caring, that's the C in the pact. And T, treating, which is developing new treatments for Parkinson's disease. So when we talk about preventing and we talk about prevention of illness and health, we have to think about environment. And could there be things in the environment? We have to think about exercise. Now, if you look, we just wrote a piece for the Journal of the American Medical Association, a review article, and then also a patient page came out in JAMA just in April here. And exercise is super important, and all of the experts are now prescribing it for Parkinson. It's been a shift. And then, of course, could there be drugs, and could we develop drugs that might prevent the disease? And there's been a search for these. We're uncertain at this time, and we can't put our nickel down on any of these drugs or exercise definitively, but there's a lot of research going on in this area. Let me touch a bit on pesticides and how important pesticides are. And of course, everyone knows the very famous and overused cliche that about the environment and the cause of disease. And so they talk about the drugs and the genes that are involved. And so they talk about the genes loading the gun and the environment pulling the trigger, and how important pesticides are to Parkinson's disease. And so things that we can do is we can ban specific pesticides that we know are associated with high, what are called odds ratios. So that's if you went to Las Vegas and you had a bet, and the bet was the odds ratio was a 1, that would be a push. Nobody would win. But if the odds ratios start to escalate over 1, we begin to see associations. And we have now pesticides where we know the odds ratios for risk of Parkinson are sailing way above 1, 2, 3, 4, even 9 and 10. So banning specific chemicals is something that's important. One that we focus on in the book is a chemical called paraquat. And when we think about paraquat, it's the pesticide with the strongest link to the disease, and it's been banned in 32 countries, okay? In the United States, its use has doubled in the past 10 years and has not been banned. And so I think understanding, how we can get a hold of some of these risks that may be driving the numbers in Parkinson is going to be extremely important. And here's a map just showing paraquat use in the United States. And I know many of you maybe in Germany or overseas, there are similar maps for various other countries as well. But look at the US, something we're not proud of. Not only are we not banning it, but as the Environmental Protection Agency lifts a lot of the regulations under this particular administration, we're seeing now a spike in the use of this. So this is not good. I always ask people, where do you live? And tell the story that my house here in Florida is 11.3 miles from a Superfund site. And if you read, the Superfund sites in the United States are where there needs to be cleanup, where there have been spills of various chemicals. Dioxin is the chemical that's in that Superfund site. Dioxin's part of Agent Orange, okay? So these are the orange barrels that were used during Vietnam, and this is the pesticide that's now also been linked to a higher risk of the later occurrence of Parkinson's disease. This is in orange barrels, and actually another type of environmental toxin, TCE, trichloroethylate, is in blue barrels. And it's kind of not funny, but the colors for the University of Florida are orange and blue. So if you remember, the orange barrels are Agent Orange and the blue barrels are TCE. These are things that have been associated with higher risks of Parkinson's disease. And so this is the blue barrel of TCE, and a correspondence going back many years ago in the Journal of the American Medical Association to 1932, talking about the toxicity of trichloroethylene. And so important that we think about this. So we talked about prevention, and advocating is the other thing that we've learned from polio and HIV and other things, that we know we need to learn from the examples of these diseases in order to do better. And when we think about advocating, you know, if you look at the polio story, and when we wrote this book, Ending Parkinson's Disease, we went back and we began to study these diseases. And polio, actually, this story went all the way to the White House and to Franklin Delano Roosevelt, here pictured with the famous comedian Eddie Cantor at the time. And people would mail in their dimes to the White House. And so they had a great advocate all the way up to the President of the United States. And they were huge in advocating for change and for research and for driving the eradication of the disease. If you look at HIV, human immunodeficiency virus, when I started my career, this was a uniformly terrible diagnosis to have without any treatments. And the HIV community came together and they were just tremendous advocates. They occupied the FDA building. They put a condom on the house of one of the senators or Congress people from South Carolina that was opposing them. And they just got the word out. They created quilts. They did everything they could. And this is where the advocacy has been so important. And honestly, and I don't mean to criticize the Parkinson community, but after researching these other diseases, we need to be more charismatic. We need to be more active, and we need to really advocate in a much more aggressive way if we're going to get control of the disease and get ahead of Parkinson disease. So how would I grade our response and advocacy? Well, you can see I've given it a grade here in the US, and F- is about as bad as you can get. So after the research for the book, we think that it's been disappointing. We think that the disease continues to grow in an unchecked manner, and that this is really worrisome, and we need to do better. Hang on for a second, folks. I think I've got a stuck slide here. Here we go. Now, the next thing we're going to talk about is care. And when we talk about care, we need to think about this as the C. So we've talked about P is prevent, A is advocate, C is care, okay? And if you look here, this was the recent review led by Melissa Armstrong from our center at the FIXL on a proposed algorithm for treating Parkinson's disease. I'm not showing you this so that you can key in on every little detail on this slide. I'm showing it to you to tell you that we are in a generation where people really falsely believe that there's a myth that there aren't treatments for Parkinson's disease. Not only do we have, you can see on the right, exercise and physical and occupational and speech therapy, and these things are now appearing on these algorithms in the major medical journals, but we also have medications and we have surgical therapies. And so we have interventions and things that we can do to help patients today. And the tragedy in my clinics, in your clinics, everywhere all over the world is that we're not getting the word out that this is a treatable disease. And when we give the diagnosis of Parkinson's disease, we should be really emphasizing what types of treatments that we can offer. We need to also develop better models of care for Parkinson's disease. And so in thinking about developing better models of care, this is the care that we use at the FIXL. There's a care model that's in the Nijmegen in the Netherlands from Bastian Bloem, who's one of the co-authors. There's a care model by Nirj El-Adi in Israel. There's a care model by Mark Gutman in Canada. We need to be thinking of better ways to deliver healthcare for complex neurological disorders. And it makes sense to have people under one roof, to have patient-specific care plans, to make sure every patient's a potential research patient and we're tracking outcomes and databases so we can drive the research for the next generation. And patients and clinician researcher relationships should be bidirectional. So researchers and clinicians should feel a part of the journey as much as the patients. It shouldn't be just about the patients. We should be developing an integrated network where we care about each other. So in thinking about some of the things that we've learned, this is from one of our first books on this, 10 Secrets to a Happier Life, that was translated into over 20 languages. This is one of the quotes from the book. This is, "I look for a sign. Where to go next? You never know when you'll get one. Even the most faithless among us are waiting to be proven wrong." And this is from the novel Pretty. And with my apologies to the Alzheimer's Association, but if you receive a diagnosis of Parkinson's disease, it's not Alzheimer's. It's not ALS. It's not Lou Gehrig's disease. It's not a brain tumor. It's not a stroke. And people, when they get the diagnosis of Parkinson's disease, it's a myth. They are sort of sentenced, and the way that it's delivered to them, they're sentenced to a life of tragedy. And it doesn't have to be that way for patients. And we need to make sure that people understand that, and they're exposed to the C. Parkinson: prevent, advocate, C, care. We need to care for these patients. The other things that we've learned, and this is another quote from the book, this is by Joshua Harris, is the right thing at the wrong time is the wrong thing. So this is from 10 Secrets to a Happier Life. And it's so important and so critical in Parkinson's. And one of the myths is that you just take the medicines as you're prescribed and you're going to get better. Well, it turns out that you've got to pay attention to timing. Timing is critical in this disease. The right thing at the wrong time is the wrong thing. We need to help people to understand how important it is to get the timing of the medications and the timing of the therapies correct. And this is the darkest slide that I'll show today from the 10 Secrets book. This is, I have a favorite cemetery. This is by Jared Kintz. I have a favorite cemetery I go to because it's really clean and the doctors and the nurses are all very nice. And we have discovered over time that it is really dangerous for Parkinson patients to go to the hospital. And that's why we've developed these free aware and care kits. We've given out over 100,000 of them from the Parkinson's Foundation. And we have a free helpline full of nurses. I believe there's 7 nurses now, I heard this morning, staffing our helpline. We have web-based areas where you can ask questions. And so I want to remind Parkinson patients to be prepared if you go to the hospital, because the very first requirement in a hospital is that it should do the sick no harm. And these kits have really cool things in them. They have rip-off checklists and things you can give to the doctors and nurses to make sure that they're doing the right things. And how about research? Well, people are definitely waiting. And one of my favorite pictures is the man standing on top of the globe looking at his watch. It matters. The time matters. And so this is the T in the Parkinson Pact. We are woefully underfunded. And the biggest funder of research in the world is the National Institutes of Health in the United States. HIV research receives $3 billion a year, and that was mainly due to due to their advocacy. This prevented thousands, if not millions, from ever developing HIV. Parkinson's disease receives $201 million a year, so less than a 10-fold difference between the two. If we're going to dent this, folks, we're going to have to increase our funding and increase our world collaboration and cooperation. Why should we be funding Parkinson's disease? People say, well, you have these yellow pills called Sinemat or Matapar or dopamine. Well, dopamine replacement pills are still the best treatment for Parkinson. However, the treatment is over 50 years old now, and the treatment does not stop disease progression. And so people should not be tricked into not funding the disease because of that. So here I've circled for you Parkinson's disease, and this is the NIH funding. Look at what arthritis is getting: breast cancer, Alzheimer's, and diabetes. So if we're going to make a dent in this, and we're going to get to the T, to better treatments, we're going to need more funding. So what's on the horizon? And I never talk to a Parkinson group and a group of Parkinson patients without offering you some of the hope and things that we're looking at. So in the book, we also review, there are target-specific genes, okay, that we're looking at for personalized treatments. Deep brain stimulation and new neuromodulation techniques. We're reading signals off the brain and responding to specific symptoms. Drugs are now in development, and drugs like Humira for arthritis and all of those drugs like it are called TNF alpha drugs, and they've been recently shown in JAMA Neurology to be associated, users are associated with a lower risk of later developing Parkinson's disease, raising that inflammation issue. When we talk about neuroprotection or modifying disease progression, again, we come back to Franklin Delano Roosevelt, who played a role in the polio story. And he talked about one thing is sure, we have to do something. We have to do the best we know how at the moment. If it doesn't turn out right, we can modify it as we go along. And look at these drugs: azithromycin, inosine, pioglitazone, Anti-malarial drugs for Parkinson's disease. Interesting, huh? You've seen anti-malarial drugs actually pop up in drug screens for all sorts of diseases, and you saw them as a possibility for the corona pandemic. So we need to develop those drugs. We're developing ways that we can look at brain signals and use the signals in real time to respond to treatments. So figure out what each brain signal corresponds to the tremor and the bradykinesia and the depression and the anxiety, and develop what we call closed loop or adaptive treatments. This is one of the things my lab's been at for a couple of decades. And of course, vaccines. And you've heard a lot about vaccines and immunotherapy. This is from William Foge. Vaccines are the tugboats of preventative health. And there are vaccines now in development for Parkinson's disease to try to stimulate the immune system or try to use the immune system to clear out the Parkinson proteins. And what we don't know is whether or not clearing these proteins is going to either improve the symptoms or modify disease progression, and what sorts of side effects this approach may have. Also on the horizon is pushing light into the brain, something called optogenetics, which combines genetic engineering, optics, which is light, and light-sensitive molecules to control cells in very precise ways, and also DREAD, designer receptors exclusively activated by designer drugs. So I think we're going to see designer drugs for Parkinson's disease. But whatever we do, we're going to have to develop a biomarker, because when we put patients into Parkinson trials, similar to cancer trials, we need thousands of patients to show whether a disease will slow progression. If we could come up with a way to measure changes in the brain or the blood or an image or some way that we can measure disease progression, we can drop the number of patients needed from thousands to hundreds. And this is one of the markers that's in trial by David Valancourt here at the Fixed Cell Institute at the University of Florida, an MRI biomarker. So thank you for the invitation to speak to you this morning. We have about 12 minutes here left in our session, which ends at 11:45. We do have a new book coming out in July called Living with Parkinson's Disease. This is in follow-up to our Parkinson 10 Secrets to a Happier Life and 10 Breakthroughs treatment. And we have a website called parkinsonsecrets.com where I do a blog that's available. Publicly available. And then just a reminder, the Parkinson's Foundation has a free online helpline, 1-800-4PD-INFO. It's not only online, but you can also call them and speak to a nurse. And they have corona information at parkinson.org/coronavirus. So thank you again for the invitation to speak. I hope you all have an opportunity to pick the book up, and when you're using social media, to hashtag Parkinson's Pact so we can get the word out so it doesn't get lost, and all the proceeds are to charity. So we would love it if you send us any comments or get up on Amazon.com and get the book and share a review for us. We think it's super important. And so thank you again. And I'm going to stop my screen share here. And I'm looking here at questions that have come in, and I'd love to spend the last 10 minutes with you answering some of the questions. So good morning first to Jose Delgado. Good morning. Thank you for logging in, Jose. John Humphreys says hello as well. John, nice to see you. John and I saw each other at the White House a number of years ago, and it's been too long, so hopefully I'll see John again soon. He's a great advocate for Parkinson's, so it's great to have you on here. Catherine asks us, her husband has Parkinson for more than 16 years, and in the last 2 weeks, he's been in the hospital twice. I'm really sorry about that, Catherine. He was diagnosed with several pulmonary embolisms in both lungs and DVTs. Anyone had issues with blood clots? So Catherine, one of the things that we worry about during the coronavirus is with the immobility and people being isolated in their houses, they move around less. And when you move around less and you have less motion, same thing happens when you go on an airplane ride. You're at higher risk for blood clots. And so that's the first thing that I'll point out to you is that could be what's going on. There are also many reasons for blood clots from the heart and for other coagulopathies, meaning things that cause your blood to sort of thicken up and coagulate. And so you want to make sure, and I'm sure the doctors are looking at those issues. And then we've also seen people with pulmonary issues, lung issues with COVID infection. And so at our hospital, we have the luxury of, we've developed our own testing for COVID. So every patient that goes into the hospital here at University of Florida, we test them for the COVID virus. And it could be we're seeing strokes and other things that we have never seen before associated with viruses like influenza. We're seeing a very different pattern with this virus, with corona. So super important that if you have availability to testing, Catherine, that you reach out on that. So Richard Underwood, Richard, thank you for the question, is asking what's your view on the ultrasound treatment. So ultrasound has received an FDA approval for a single target in the brain and for use on one side of the brain. The way it works is you shoot a sound wave from outside the brain toward a structure called the thalamus. Now, the thalamus is not the structure that we usually target for deep brain stimulation, but is a structure that we target for a disease called essential tremor. And it's an adequate treatment for the tremor of Parkinson, but not for the other symptoms of Parkinson. Okay, and so that's the first thing you need to know about that. If you have medication refractory tremor, meaning the medicines aren't working and you're getting tremor, you can utilize this treatment, but it may not treat the other symptoms of Parkinson's disease, but it may be effective. And then since the waves come from outside the brain, you don't get the benefit of some of the mapping and physiological confirmation when you stick the probes actually in with either an old-fashioned thalamotomy, or which is making a lesion in the thalamus, which is the same thing that focused ultrasound does, or with microelectrode recording and deep brain stimulation. And so the keys to remember with focused ultrasound therapy is, the cool thing is it comes from outside the brain, so they don't have to make a whole craniotomy, and you don't get infections or things, and you don't have to manage the device. The limitations are only one side of the brain, may not be as localizing of a lesion, and that lesion has to go in an area called the thalamus, which is good for tremor, but not as good for the other symptoms, but certainly approved for Parkinson and a very reasonable treatment. It's been around, ultrasound therapies in the brain, since 1958, if we look at the Neurosurgery Journal. So a really interesting therapy. So Kathy says, thanks for the plug. Everyone can call the Parkinson's Foundation and order their Aware and Care kit for free. So thank you so much, Kathy, for saying that. It's on the chat here. We've given out over 100,000 of these Aware and Care kits. I actually have one here in the studio to show you. We've been doing these coronavirus webcasts from the studio. This is the Aware and Care kit, okay? And it's just a little kit. It's like if you get sick and have to go to the hospital, or if you go, it has everything inside this kit. You can see the Parkinson Foundation area here, their logo, and also the 1-800-4PD-INFO. That would be an international number you can call. 001 is the code for the US if you're outside the US, but it is a 1-800 free info. So super important. We think about packing kits when our kids are born and we go to the hospital. We pack a bag so we're ready to go to the hospital. People in the hospital have no idea how to treat Parkinson's disease. They're treating all sorts of things. It's up to you to teach them, and that's what the Aware and Care kit is all about. You're going to be the advocate that teaches them how to do that. Russ, thanks for writing in, Russ. We lost you for a minute on Wi-Fi. You're back, so welcome back. Kathy just wanted us to make sure you have the right number. It's 1-800, the number 4PD-INFO, 1-800-4PD-INFO. And if you click at the bottom of your screen, there's a little thing called chat. If you click it, it'll be in there, and Isabel can probably either email or follow up and make sure they have that number. What's awesome is there are 7 of the best trained Parkinson nurses run by Adolfo Diaz. This has been going on for many years, and if they can't answer a question, then they ask me as the medical director, and it's awesome. I mean, it's a great service. So John Humphreys, thanks again, just writing about thanks for the PD advocacy. We have a couple of minutes left if anybody has questions. I do want to mention a couple of things just because during Corona here on this group, important to stay socially isolated, but as there is going to be an end to the coronavirus, so at some point you're going to need to start picking up masks, because the next phase, you're going to need masks to be going out into into public. We want to keep you safe, and just remember that the risk to getting coronavirus, we don't know because we don't have all the data, we think is about the same in Parkinson, but if you get it, the recovery is harder. We've said this from the very beginning, from the very first week we started broadcasting with the Parkinson Foundation on these great webinars that are available at parkinson.org/coronavirus, all one word. We said this from the very beginning, that hydroxychloroquine was probably not a good idea. And so you're seeing it now play out in the news. So don't rush to try those things. And then this whole rumor about ibuprofen being bad has also, we said that in the first week as well, has also not proven true. Gurgling, garlic, and all these things that we have seen, also not great. But you can call our helpline and they'll give you the skinny on things. I also want to note that we have people not just from Germany, we have people online today from Italy, from the United States, from the United Kingdom, from Austria. And so thanks, Isabel, for pointing that out. And there's a question from Jose about what I think about deep brain stimulation. I think it's, as we wrote recently in our paper that's available in the Journal of American Medical Association, we wrote about this, that it's a good treatment for a subset of people with Parkinson's disease. Not for everybody, but for a subset of Parkinson's disease, maybe 1 in 5 or so, and depending on your symptoms. It's great for on-off fluctuations, great for dyskinesia, great for tremor, not good for walking, not good for balance, not good for talking, okay, and not good for thinking. Those are the things that DBS isn't good for. And so we have some information that Kathy, our Whitlock at Parkinson Foundation, has put together a whole website page where we have blogs that I've written. We have papers that have recently been published. We just published a paper in the Journal of Parkinson's Disease with recommendations for deep brain stimulation during a pandemic, where we have recommendations for how to handle your batteries if you have a battery issue. And so it's super important, and we want to direct you to that information and make sure that you have access to it. There's a question here from Massimiliano, looking at Ayurvedic or alternative treatments from India and Parkinson's disease. The answer is, some of them probably work and we just don't know yet which ones. And so we're beginning to appreciate that some of these alternative medicine treatments, do have some positivity. And I think that it's super important that we don't dismiss them, out of hand, but also remember the story of hydroxychloroquine. You can go in, you can start taking these things, and they might worsen. They might worsen your symptoms. And so don't rush in, always talk. You can always call our 1-800 helpline, check with your doctors and your healthcare teams. So with that, we're sitting at about 15 minutes to the hour, Isabel. And so it's been just a pleasure and an honor. And I see how many people have shown up here for the talk here this morning. And it's been great to be here. And thank you so much for having me. And I really just appreciate this worldwide group that you've put together. And I want you all to stay safe.
Thank you so much, Michael. I really appreciate you coming in and telling us a little bit about everything. And I really appreciate all your hard work. And, everybody should pick up the book. It's fabulous.